make time for yourself. There's a picture right there. Completely isolated from the baby and from life herself. Is that one of the more difficult things to do, is tell a mother, you've got to avoid this isolation. They feel as if they need it at this point. You've got to pull them out.
Absolutely. You need to pull them out of that isolation. Even though they feel that's what I need at this point, that's actually counterproductive to what they need to do. They need to be out. They need to be involved with family functions, and they need to be there with their baby. That's where the bonding comes into play. And if they're missing all of that later, they're going to have regrets. I missed those first 3 months of my baby's life because I wasn't feeling like myself, so I isolated myself. So this needs to all be put together.
And here is the last one. Ask for help. We're going to put up a graphic here, which is very important, doctor. We need to make sure that people understand this. If you are in a crisis, call 911. Call National Suicide Prevention Lifeline. The number is there. 211 is Switchboard of Miami. Text HOME 741-741 in the U.S. Visit imalive.org to start reaching out, start a chat. Do you find yourself needing to press this to a lot of people? Because this is so critical to know.
It is. They need to understand that there is help out there. They need to know there are people there waiting to engage them and to help them, even if they may not have the best family support. So yes, these numbers are critical to get across to the patients.
Even if you have family support, there are times when 911, National Suicide Prevention, the 211 switchboard will be very helpful at that point, because sometimes the family's not there every single second of every single day.
Exactly. It could be 2 o'clock in the morning and the baby's awake and you're having a moment. You call one of these numbers and you start talking. It's basically therapy that you're doing with these numbers and these people on the other end. They're therapists.